Welcome to the Food Junkies Podcast. Here, we aim to provide you with the experience, strength, and hope of professionals actively working on the front lines in the field of food addiction. The purpose of our show is to educate you, the listener, and increase overall awareness about food addiction as a disease with abstinence as the solution. Here, we talk about all things recovery. Most importantly, how to thrive rather than just survive. So stay positive. Make a change for yourself, tell others about your change, and hopefully the message will spread.
What is the relationship between food hoarding and food addiction? Is there one? Welcome to the Food Junkies Podcast. My name is Dr. Vera Tarman, and I am your host today, speaking with Dr. Amanda Rains. Dr. Rains is a distinguished clinical investigator at the Southeast Louisiana Veterans Healthcare System and an assistant professor in the Department of Psychiatry at the LSU School of Medicine. With a doctorate in clinical psychology from Florida State University, she has over 13 years of clinical experience, specializing in treating patients with anxiety and related conditions, including those which intersect with hoarding behaviors. She has published a number of peer-reviewed articles focusing on hoarding disorder and its associated psychological aspects. I came across Dr. Rains' article, Hoarding and Eating Pathology, the mediating role of emotional regulation, which explores the relationship between hoarding behaviors and eating disorders and obesity. We at Food Junkies Podcast are interested in exploring the co-occurrence of hoarding and eating pathologies, and if this dynamic may help us understand food addiction as well. Welcome, Dr. Rains.
Thank you. Thank you for that lovely introduction. I'm so happy to be here.
Okay, good. We always like to get a bit of the personal stories. What got you interested in the psychology of hoarding?
Great question. So when I got to Florida State University, I actually did both my undergraduate and graduate work there. The science of psychology was very much new to me. I was a psychology major, and I had started working in several laboratories on campus, including that of my future graduate student mentor, Dr. Brad Schmidt. So his lab, which is the Anxiety and Behavioral Health Clinic, focuses really on the prevention and treatment of anxiety and related pathology. And at the time, obsessive compulsive disorder and hoarding disorder were both included in the anxiety class disorders in the DSM. And so I was working actually with one of his graduate students, Chiara Timpano, who's now Dr. Timpano. And I recognized just how little, honestly, we as a field really understood about the causes and consequences of hoarding, which was an extremely debilitating condition. So I ended up working with her on some of her projects at the time, and then was so fascinated by this area of work that I continued in this as a graduate student in his laboratory.
Thank you. For our listeners, can you please tell us generally what hoarding is and the specific types, stats attached to those?
Absolutely.
Prevalent they are.
So hoarding is currently defined as difficulty discarding or letting go of one's possessions, really regardless of their value, and need to save stuff results in a lot of clutter, which precludes people from using spaces for their intended purposes. And one of the most interesting things about hoarding is that the reasons why individuals who hoard save are actually no different from the reasons why any of us save. So things like this item might be useful in the future, or this item has some sort of aesthetic value, or might just even be something that I'm sentimentally attached to, like a card that my mother gave me. And then there's also some folks who have more broad-based fears of things like loss of information or just general sort of waste. And hoarding disorder is estimated now to impact anywhere between 2 and about 6% of the population, depending on where you're looking at it. Those rates can vary depending on countries. And for many individuals, what we also see is that these behaviors actually oftentimes start pretty early in life. And for most folks, we see that they're actually hoarding a lot of inanimate objects, so just everyday sort of items, whether that be food, whether that be things like newspapers or just old things that are around your house. But we also see that some individuals hoard things like animals, which is not really just defined by the number of animals that the individual has, but really the failure to provide minimal standards of things like nutrition, sanitation, and care. And although there is not a specific classification for food hoarding, we oftentimes see that folks who hoard in general do hoard other things like food items.
When I read up a little bit on this, I saw that there were some subcategories like food hoarding, pet hoarding, and inanimate objects. What about a person who's collecting baseball cards from early on? Is that a sign of a potential hoarder in the future? We are collectors, a lot of us.
Yes. No, we typically think about normal sorts of collecting behaviors as being distinct, and that those behaviors are oftentimes very organized. They're oftentimes in one really just area based on an interest, whether that be stamps or baseball cards. And so generally, those things aren't precluding someone's living spaces for their intended purposes. There also tends to be a little bit more of an order or organization to those items, whereas you do not see that in traditional folks with hoarding disorder. There tends to be a wide range of items saved, and also a lot of disarray, squalor sometimes, and obviously clutter.
Yes. And you said something about, I was struck, you said about pet hoarding, that it's actually not the numbers of pets, it's the inability to care for them.
Yeah, that's what we oftentimes see. And we try to, once again, not over-pathologize behavior, which can be normative. If you think about someone who maybe lives on a farm, who might have folks who are helping them take care of the animals on that farm, they may have an actual large number of animals that they're caring for. But in these instances, when we think about animal hoarding, we're more so thinking about this failure to provide minimal standards of nutrition, sanitation, or care, which really distinguishes that from more normative animal care.
Right.
And unfortunately, I would say both with things like food hoarding or even animal hoarding, we know a lot less about these kind of subtypes than we do about general hoarding because the rates are obviously smaller. One of the things that you've probably read about or seen is that hoarding can be really difficult to treat. So it's not a population that we're oftentimes getting into treatment to be able to study as readily as we are things like generalized anxiety per se.
You said that we don't know that much about food hoarding, but tell us what we do know about food hoarding. Like, what is it specifically? What does it look like?
I would say with the majority of research on food hoarding that or at least that I know about, really is seen among animals. But animal models have been a great way for us to understand human behavior. And I'll talk a little bit about that probably in a minute when we talk about my article and some of the other things, research that's been done in my laboratory and others. And so we do see a lot more just general hoarding among humans that could involve food, but that oftentimes involves a lot of other objects as well. We do, though, sometimes see food hoarding among children, particularly individuals with Prader-Willi syndrome. For some reason, there tends to be a link between that syndrome and hoarding behaviors. And then I would say a lot of food hoarding research also happened in the COVID-19 or during the COVID-19 pandemic, where we actually saw people starting to hoard food and just panic buying in general of like household items that I think there was a lot of fear around may not be available, or there may be scarce resources of these items.
Interesting. That was instigated by probably the grocery industry to buy all these things.
Yes.
For a just-in-case scenario. You're saying that we don't really have any statistics about food hoarding. It actually surprises me when you say that it's not that common. I thought it was actually quite common.
Yeah, so I think it oftentimes gets lumped in with hoarding in general. And I'm not aware of exact prevalence rates with regard to specifically food hoarding, because I think a lot of times we see it so much with other behaviors, so it's not isolated in that way.
Right.
But I would say that just from my clinical work in general, a lot of the folks I worked with did hoard food in addition to other objects, whether that be objects that they perceive could have some utility in the future, or even sentimental items, but also this fear of waste. And that's one of the more common sort of reasons for saving that we see among individuals who hoard. That's also shared among individuals who don't hoard. We're just applying them to a lot fewer items.
What are some common myths and misconceptions about hoarding disorder that you would like to dispel for us?
I would say that probably most common misconception that we see, both anecdotally and just in the literature, is that hoarding is somehow related to early sort of material deprivation. The research has not really supported that hypothesis. It is definitely the case that some individuals who hoard maybe had a scarcity of items growing up, or maybe in some way were exposed to an impoverished environment. But we see hoarding even among folks who didn't have those sorts of events growing up. I would say, though, similar to what we see across many psychological disorders, we do see a link between stressful life events, trauma exposure, and hoarding, such that oftentimes some sort of event, not necessarily related to deprivation, will precede the onset of things like PTSD as well as hoarding disorder.
Like it's a stress response, as it were.
Exactly.
Yeah. Are there any more misconceptions or myths that you'd like to address?
No, I would say that's probably the largest one that I see. Yeah. And I guess the other myth just being that there's something distinct about the reasons why these individuals hoard. Like I mentioned, the reasons for saving are really no different. They're just applying them to a larger volume of items than the normal kind of average human might be.
We're going to be talking about the psychology behind that, but you mentioned that your department is looking at hoarding and obsessive compulsive disorder. And I would think, is it a connection there?
So originally, hoarding was considered to be a subtype or a feature of OCD. And this was really the case for a long period of time, where we really thought about it as being this component of OCD. However, hoarding was actually only mentioned in the DSM-4 under the obsessive compulsive personality category. But there was a lot of research into OCD and hoarding more specifically because these self-report measures that we were giving individuals with OCD contained oftentimes this subscale that assessed problems acquiring and difficulty discarding. And so it was something that got lumped in with OCD because of that. And so I would say probably in the late 1990s, early 2000s, there was this huge kind of influx of research into hoarding disorder. David Tolan, Gail Sekety, Robert Frost were some of the real sort of pioneers in this area. And they started to recognize that hoarding differed in a lot of ways from OCD in that the thoughts about the behaviors were not oftentimes considered intrusive. And the behaviors themselves, although they could be categorized as being quote unquote compulsive, were actually pleasurable and didn't induce distress. Whereas OCD sort of compulsive behaviors did have a lot of distress associated with them. Some of the other sort of primary distinctions were that
I guess the distress was more the neighbors or the family or the people living
That's exactly
there.
right. Yeah, that distress was oftentimes identified by other people living in the home or the family members of the individual, sometimes even neighbors and that sort of thing if the hoarding had started to extend to the exterior of the home. And they also started to really notice that the relationships between OCD and hoarding were no stronger than between OCD and anxiety or OCD and depression, really calling into question the nature of the fact that hoarding was a subtype. And so it was at the time of DSM-5, when that was released in 2013, they actually made hoarding its own discrete diagnostic entity. They kept it within the OCD spectrum of disorders, but moved that whole section out from the anxiety disorders module and put it in its own module, just given that they had also noticed some distinctions between OCD, hoarding, and anxiety as well. And so I would say even since that time, we've seen a large increase in the number of studies looking at causes and correlates of hoarding, which has really, I would say, expanded our knowledge base and led to the development of a really great treatment, although it's still a treatment-resistant population.
Yeah. So what is the criteria then for hoarding disorder in the DSM?
So primarily it consists of difficulty discarding, clutter, which precludes the use of spaces for their intended purposes, and then obviously distress and impairment related to those symptoms. We also like to ensure that the behaviors are not the result of some other psychiatric condition. We just want to make sure that there's nothing else going on that might account for those symptoms. I would say the most notable difference from the proposed diagnostic criteria that we were really working with pre-DSM-5 to DSM-5 was that what we see is that not all individuals who hoard actually excessively acquire. So there's about 10 to 20% of folks who don't report excessive acquiring behavior. So it's really just the collection of everyday things that they can't seem to get rid of.
Yeah.
Which is interesting because I think we oftentimes think about these people as being people who are either overbuying or maybe over-collecting junk or things that they might find in their environment, but that's not always the case.
It could be you can't let go of your thing.
Exactly.
Here's an example. A person who does struggle with weight often loses weight. They've got a whole collection of clothes that fit, and then they have a new set of clothes to fit their current weight. They end up having all sorts of different sizes, but they don't want to get rid of them because you just never know.
Exactly.
When you need it.
Yeah. And that's that sort of thought behind like future utilities. There may be a need for this item in the future for myself. What if I can't find this item again? And that sort of thing.
Yeah. So those are criteria. How many do you have to fulfill in order to fulfill the criteria? Like just any one of those?
No. So you actually need the difficulty discarding and the clutter. It has to cause significant distress and impairment, and then it can't be better accounted for by another disorder. So you actually need all. The acquisition piece is now just a specifier. So you can specify whether or not the patient also has excessive acquisition, which can be helpful because obviously if that's something that a patient's presenting with, you may want to generate some exposures around having the person be out and about in their environment without acquiring, despite this being urge or need to acquire.
Okay. Now let's talk about your study because I want to get to the whole idea about body mass index or obesity and symptoms of eating disorder like binge eating. Elaborate a little bit on some of your findings.
Yeah. So I'll take it a step back because this idea really came about through other research that was happening both in my lab and then outside of my lab. So there had been at the time a number of studies to look at the link between hoarding and obesity. And one of the first studies to really document this association was by Dr. David Tolan, who I mentioned earlier was really a pioneer in the field of hoarding. And he actually compared body mass index across a large sample of individuals with hoarding disorder and their family members and found that those with hoarding disorder were nearly 3 times as likely to be overweight or obese compared to their non-hoarding family members. Dr. Timpano, who was a graduate student in my same lab, followed this up by identifying a specific gene that she found that was actually related to both conditions. Basically the BDNF gene and a variant of that gene And then I really wanted to expand that work because she hypothesized that this gene might play a role in the expression of both of these things, but then there might be some sort of psychological factors that really contributed to this comorbidity. And that's really what I sought to do with my study, was look at emotion dysregulation and how that may be related to both obesity as well as things like hoarding disorder.
Can you elaborate what you mean by that?
When we think about emotion dysregulation, it's really defined in the literature as being this difficulty either understanding, differentiating between different emotions, and also regulating those emotions. And this is particularly the case for negative emotions, whether that be distress or anxiety. And what we oftentimes see is that emotion regulation can essentially, or dysregulation can exacerbate any sort of negative emotional state. So if you're experiencing a negative emotion and you have emotion dysregulation difficulties, you may experience sort of an increase or exaggerated negative emotion. And so I looked at the role of this in maintaining the relationship between BMI as well as binge eating symptoms, and then also hoarding disorder, using a mediational approach, looking at whether or not this sort of cognitive affective factor accounted for this relationship between these two constructs.
That's interesting. What did you find?
We essentially found that it did. Folks with elevated hoarding symptoms were more likely to exhibit increased binge eating symptoms. They also had increased levels of BMI. And levels of emotion dysregulation essentially mediated that. So if you were higher in difficulties regulating your emotions, then that link was there and stronger.
Which comes first? Was it that the hoarding was a way to moderate, a way to regulate emotions because they don't know how to otherwise, or did it contribute to further emotional dysregulation?
Yeah, that's a great question. And I don't know that we have the answers to it, at least not from my study. Unfortunately, in research in general, we oftentimes see that a lot of these associations are examined in this cross-sectional sorts of data where we just have one sort of snapshot in time, and we're able to look at these things and determine their relationship. And to some degree, mediation does imply causality. It's the way we're typically think about a mediational sort of model. My guess is that the relationships between both hoarding, emotion regulation, and obesity are really bidirectional in nature, such that these things are likely influencing one another. I think in some instances, it could be that one leads to the other or that another leads to the other one. But I think at some point, they're probably all just being influenced by each other and honestly just creating almost like a vicious cycle that can be somewhat hard to get out of without the assistance of some sort of treatment or psychotherapy.
Would you distinguish a binge eating disorder from food addiction? Do you ever speak about food addiction as an entity in and of itself?
I don't. Primarily, I think that's only because as a psychologist, food addiction isn't necessarily like a diagnosis in the DSM, although I would argue that addiction in general is a term that we use, as well as like compulsivity, to talk about a lot of behaviors that look like addiction. I recognize that from the literature, both of those behaviors likely involve reward pathways in the brain. And so my guess is that there is a huge link between addiction, particularly with binge eating disorder, and food addiction, such that individuals are using these things to regulate negative emotion, and that those patterns can become maladaptive over time, leading to increased consumption, which in turn just probably creates more of the problem.
Using that general thread of thinking that it's a general overconsumption, whether it be called binge eating disorder or food addiction, we could potentially, and we know that there's a link between that and obesity, because in the obese populations, there's higher levels of food addiction and binge eating disorder, depending on the place that you're coming from. And now you're saying also with hoarding as well. So I was really interested in, have you ever thought, or has it ever been discussed, I guess maybe in the concept of obsessive compulsive disorder, that the hoarding itself could have its own addictive quality?
Yeah, I think that's an interesting question, and I don't know that it's been really looked at enough maybe in that way in the literature, but there definitely seems to be some of those components. And I would say that's particularly true among the folks who are what we would consider compulsive buyers. That's a phrase that's oftentimes used. That's not really a DSM term, but is something that's used more colloquially in the literature to talk about these individuals who do excessively acquire and how those behaviors can become almost addictive in nature, where there is this sense of high euphoria that's attached to the buying. Sometimes even things like guilt and remorse afterwards, which we also see among substance users, where there is this sort of positive aspect of the use, but then on the back end, the behavior, because of the recognition that it can be problematic, then it can involve some sort of guilt or those sorts of things, negative emotions as well.
Yes, I wanted to flesh out some of those comparisons between addiction and hoarding. But before we get to that, the BDF, brain abnormalities, is there anything interesting about that you could tell us, the sort of genetic potential?
Yes. So that was a fascinating project by Dr. Timpano. And what she really highlighted in that paper, which I found interesting, is that there's kind of several lines of research to support this notion that this specific gene may be both implicated in weight, obesity, as well as hoarding behaviors. And she talks about, from an evolutionary perspective, that animals developed two main strategies for dealing with stress, including weight gain to increase like fat storage, but then also hoarding food because that's really what animals have access to. And she talks about how if you really consider clinical hoarding in humans as this sort of exaggerated form of this behavior, then it could be really hypothesized that these individuals who hoard may be at increased risk for dysregulated eating, but they may also be at increased risk for just saving behaviors in general, and that being food as well and overconsumption, which could lead obviously to increased BMI.
It just makes me think of hibernation, for example. There's the bear
Yes.
that has to prepare for the long winter. So it's going to accumulate as much as possible and eat as much as possible.
Exactly. And then what's interesting enough is that she looked at this gene that had been implicated using animal models in food hoarding as well as in obesity among animals, and found that it was related to hoarding among adults and humans, and that then hoarding was also related in that sample to increased BMI. So she was really able to connect these sort of distinct lines of research that were being conducted in parallel to really identify something that may be a specific gene that hopefully could shed some light on these and really other behaviors.
Okay, good. Now, what about some other psychological predispositions, early childhood, adverse conditions, anything else?
Yeah, I would say we've seen a lot with trauma, both in the research as well as more anecdotally working with patients. I've had a lot of patients who reported that some sort of early trauma was the catalyst, or at least they believe was the catalyst to the hoarding behaviors. Sometimes it would be something, childhood adversity that they went through. Other times it would be more like an adult sexual assault that occurred during formative years. And that those incidents really set the stage for both hoarding. And then I even had one patient who had comorbid sort of obesity along with hoarding. And she identified the sexual assault as being something that led to both of those, developing a lot of maladaptive beliefs about herself, her body image, and maybe what led to her to this event happening, blaming herself. And then also noted that then in turn contributed to her saving and collecting behaviors, which was really just a fascinating sort of connection. I would say outside of that, impulsivity is another sort of cognitive affective factor that we see among both conditions, just general sort of inclinations to be impulsive, to not be able to resist certain urges and those sorts of things. We also see that rates of impulsivity are higher among individuals with both conditions.
I remember reading that the death of a spouse could be another major trigger.
Absolutely. Yeah. We've seen a lot with those sorts of events as well. And sometimes even the unexpected nature of those. It seems like somehow if the death is unexpected, that can also be a risk factor, more so than if there's some sort of prolonged experience that led to it.
Hey, Food Junkies listeners. We're just going to take a quick break here to share with you something our team thinks could help benefit your recovery with food, body, or self. Thank you again for listening.
Hey, Food Junkies listeners. Food addiction is a battle many of us face, but overcoming it is a victory worth celebrating. At Food Junkies Recovery Stories, we believe your story can be a lighthouse for others on their path to freedom. I'm CJ, your host, and our podcast is dedicated to sharing real stories of food addiction recovery. We offer a safe space to share your experiences, challenges, and successes. Whether you're just starting out or years into recovery, your story matters. By sharing it, you offer hope, support, and practical tips to others facing similar battles. Ready to inspire? Joining us is easy. Just email fjrecoverystories@gmail.com or fill out the guest application form in the show notes. We're looking for individuals who want to speak their truth and empower others to find recovery. Your voice has the power to change lives. Be a beacon of hope. Share your story and inspire others on their journey. We can't wait to hear from you and share your incredible story with the Food Junkies community.
Now back to the show. If you have enjoyed this episode, please let us know. We love to hear from you. Kindly leave us a review on whatever platform you listen to our podcast on. We love getting feedback from our listeners.
I want to go back to the addiction parallel. When I was reading about this, I thought, could we visualize this? I know that the research hasn't even asked this. Maybe it's a good research question. If we think about food in general, so we're talking about food hoarding and food addiction, that on the one end, it's the accumulation of food that can be addictive. And then on the other end, it's the actual eating of the food. So a person can be both, or they can be on one end of the spectrum or another. Does that sound like a plausible idea that it might actually be a spectrum?
Oh, absolutely. I think when we think about anything in terms of in nature, I oftentimes think about it being on a spectrum. I think we oftentimes dichotomize stuff because that allows us to make discrete classes. It allows us to study these things and understand them. But truly, I think that all of these things occur on a continuum. And yeah, I think you're exactly right that these things could be on opposite ends of the same sort of spectrum.
Like you can go to somebody who's a food addict and look at their pantry and they have all the items that they may not even eat them. That's the other thing about hoarding that I found interesting was that you accumulate and can't let go of even items that are past their due date. Like it's time to throw them out, but the person doesn't want to throw them out because you just never know. That's what
Exactly. Yeah. There's always this fear of I may need it later or, someone else may be able to use it. And so there's oftentimes, a lot of saving.
And then there's also other overlays, like you mentioned earlier about the shame that a person has.
Yes.
They may have, which is endemic in the addiction field as well.
I would say shame is another one of those cognitive affective risk factors. My work since I've been at the VA, and I should note that any of the views that I'm saying today do not represent the VA, but just represent my own personal views. But yeah, some of my more recent work has shifted to look at things like shame and how that may relate to eating pathology and PTSD, which is obviously another condition wherein we know that trauma exposure plays a large role. And it's actually one of the criterion that you have to meet for the diagnosis. And we see a lot where people will have these sort of negative emotions, whether they be guilt or shame, and engage in these sorts of behaviors like excessive eating or acquiring, just mitigate that negative emotion. This is a way to mask it or just to give some sort of positive feelings. And in turn, though, the behavior can also then induce guilt and shame. So like I mentioned earlier, it sort of can create this vicious cycle that can be hard to get out of because the one thing that you're doing to relieve the negative emotion, actually in turn, it's going to cause more of it. And so a lot of times we start to think more about the sort of treatments that target these underlying cognitive affective risk factors in the hopes that might be more of an efficient way to, treat two comorbid conditions as opposed to having to go through these sort of distinct monotherapy.
Yeah.
So there's been some work looking at guilt treatment, shame reduction treatments and stuff and how those maybe potentially work for folks with comorbid conditions.
So in addiction, the question always that the family member has is, would you just stop? Why can't you stop? And the addict to themselves will say, I don't know why I can't stop. I can't stop. They know why, because they're going to go into withdrawal and it'll be distressing to not use. The negative consequences of not using their substance feel bigger in the moment than the negative consequences of using the substance. And is that a similar pattern in the food hoarding or hoarding behavior in general?
Yeah, I would say that definitely could be. I don't know that it's specifically been looked at in that way, but my guess is you're right. In the moment, this emotion, whatever it is that I'm experiencing, the urge, the craving, anything in that moment outweighs anything negative that could come from it, whether that be guilt or shame or whether that be more clutter in the home or what have you.
What happens when you say to somebody, you got to stop doing this?
It's hard. So with most of the treatments that we have now, they involve cognitive behavioral therapy. If you're familiar with that, it's one of the frontline treatments for most disorders. And CBT is oftentimes very specifically tailored to the condition or disorder that you're treating. And CBT for hoarding disorder oftentimes involves a lot of helping patients identify and challenge some of these core beliefs in the moment that they may have, which could lead to things
like being, for example, I need this substance or I'm going to be able to use it in the future.
Exactly. Yes. Okay. Yeah. And I work a lot with substance abusers in my off time and at a facility, a substance abuse treatment facility that I work at. We do a lot of CBT based stuff there. What are some of the thoughts and feelings you were having prior to use and how are those things maybe influencing your use? And then in addition, with folks with hoarding disorder, we're oftentimes having them engage in a lot of exposure exercises, which could be things like sorting and organizing. We also see a lot of information processing deficits in individuals who hoard. So just difficulty categorizing things, difficulty sorting things. And then obviously a lot of distress around discarding. So many of the exposure exercises involve discarding things. And to do that, we generally help the patient make some sort of hierarchy that sort of details items in the home. We work with items that are easier to get rid of first. That could be things for some of my patients, food that's really old or that's clearly beyond its expiration date. Sometimes those items can be easier to discard than maybe like that card from your mom that you've been holding on to for 20 years past her death sort of thing. And so it's really that both cognitive and behavioral piece. But unfortunately, individuals who hoard have such low insight oftentimes into the symptom. And oftentimes they themselves, like we mentioned earlier and talked about, don't see the behaviors as unreasonable. They're not necessarily inherently disturbed by the clutter or the squalor. It's really oftentimes other people, whether that be neighbors or family or friends. And so that's also oftentimes a really big, I would say, barrier to treatment.
That is so much like addiction, where the person says they don't see that they have a problem with their drinking, but their family does.
Exactly. And oftentimes it's the family member who's making the first call to the treatment facility, whether that be for hoarding, whether that be for substance use. They're oftentimes accompanying the patient. And the other parallel that this conversation is really making me think of is the component of family being involved. Family involvement in therapy, whether it be for hoarding or whether it be for addiction, is really an integral component to the treatment being successful. Are the people in your environment going to be helpful in this process? And are they going to engage in behaviors that might be counterproductive to the therapeutic process?
Yeah. And the other thing is that with addiction, there is a substance that you actually stop using. And what are you actually stopping with hoarding? I guess you don't let them go shopping anymore.
I would say with compulsive buying, it's probably limiting the amount of acquiring. I would say for folks without the compulsive acquisition piece, it's probably more so limiting the amount of saving. So helping them start to realize what is an item worth saving and what is an item that maybe isn't necessary to, get this item again in the future. Is it actually able to be used at the present moment?
Yep. And so in the food addiction world, the person ultimately comes to the realization, they step out of denial. That's really what we were talking about, is denial. The person who doesn't see that they have a problem, although everybody else does, they step out of denial because they look at the scale or they look at their doctor who's saying, hey, you've got diabetes now. And I guess you're saying that in this world, in the hoarding world, there's never a point at which the person goes, I really think I must have a problem.
No, I think there definitely is. I would say the disorder is characterized by a lot of low insight, but there are definitely patients that I have worked with that have recognized that, hey, these behaviors are interfering with my ability to have my grandchildren stay with me or my ability to have my kids in the home, depending on the nature of who's living with them. It could, preclude them from being able to take care of a loved one. In some cases of elder abuse or those sorts of things, are the conditions able for the other person to live in? And so I would say it's not always the case.
Yes.
But it's one of the most interesting, I would say, aspects of hoarding disorder is that lack of insight among so many of the patients and the inability to see that these behaviors have really become an excess and are really impairing their ability to just do everyday routine things like cook in your own kitchen, sleep in your own bed.
For somebody who's listening, who's thinking, oh, geez, maybe I am, what would be some key features? Are they essentially some of those things that you said? Do you have items in places where they shouldn't be?
Yeah, I would say the main thing to think about is the utility of your spaces. And so we all have maybe that room in the house where we keep all of our extra stuff, or that attic that's way too full, or even the shed that maybe is filled to the brim with the things that we just can't get rid of quite yet. Or in the case of my parents, all my things that I've left there since leaving for college. But I would say that if you're really unable to utilize main rooms in your house, like your bathroom, your kitchen, and your bedroom for their intended purposes, or that the clutter has become so significant that you're at risk for falling, or that you're at risk for maybe being able to exit should there be some sort of fire or something in the home, I would say that's really when you want to start to consider maybe talking to someone and maybe reaching out and getting some help.
Knowing that you yourself may not actually see that.
Yes.
Yes. Let's talk about treatment. You mentioned CBT. What else? In the addiction world, CBT is helpful, but the most effective thing is to remove the substance from the house. If it's sugar addiction, don't have it in the house, and that already makes it a lot easier. So what kind of treatment, either medication or behavioral?
Yeah, SSRIs, the serotonin selective reuptake inhibitors, are still one of the frontline medications for most what we would consider sort of anxiety and related disorders like hoarding. And those medications can be helpful. However, they're not a fix. And so I oftentimes think about them as like a life preserver. They keep the patient afloat, but they're not really teaching them how to swim. And so CBT is great because the patient's actually engaged in sort of those thought challenging exercises, the discarding exercises, which is really going to be helpful for them starting to understand that they can tolerate the distress associated with getting rid of stuff. And they can also then start to see what it's like to have a home that they actually can function in a meaningful way, have people over and that sort of thing. I would say that what we see a lot on TV with shows like Hoarders on A&E, and oftentimes that we think about with things like flooding, where a patient is in a really fast time exposed to mass discarding in the home. And I think just like with anxiety more broadly, those treatments can be helpful, but unfortunately, there's oftentimes a high level of relapse if you're not really continuing to work with the patient beyond that sort of massive clean out. Because what you're really wanting them to learn is that they can tolerate distress in the long term and that they can start to make these decisions on their own. And sometimes that involves a little bit more one-on-one work than you may get in some of these interesting, but obviously produced for television sort of shows.
The distress is holding on to, isn't being forced to let go.
Yeah, and if it were as easy as just taking something away and then being okay with it, they probably wouldn't have developed hoarding in the first place, because the first time someone threw something away, they would have just recognized a couple of weeks later, oh, okay, that's not that big of a deal. And so you really do oftentimes have to work with these patients to build their distress tolerance, to increase that. I oftentimes think about distress tolerance like a muscle that you have to build. And so that's really what you're working on them with to build. And then once again, like I said, helping them start to develop more adaptive ways of thinking about their items or thinking about saving that don't involve all of these sort of things like future utility and aesthetics and all of those things that are just applied to way too many items.
Yeah. I think we use comfort eating. This is like a comfort holding on.
Oh, yes. A lot of the early research in hoarding, when they were developing the sort of reasons for saving and measures that assess these reasons for saving, was done through a lot of just clinical work with patients, asking them about their items and why they had them. And a lot of them you could tell there was a lot of positive emotions that were engendered by these things being around them and feeling comforted by these things. And so that's definitely something that you want to address in therapy.
Yeah, that's actually where the addiction is. So the external element of that, whether it be food or it be this memory, this item that represents something that's giving comfort.
Yeah. And you're right. We see it a lot with food too, where they're distressed and food provides some sort of comfort, or drinks or alcohol provide some sort of comfort, or any other substance for that matter.
What would you say is the most successful type of treatment that you've seen?
I would say CBT is by and large the most successful. I think that both working with a patient one-on-one, as well as if you can involve, like I said, family members. I think we oftentimes see, it depends, but a lot of times we do see that sometimes CBT will outperform the combination of medications and CBT for certain conditions. But both with hoarding and OCD, given the sort of treatment resistant nature of this population, it can be nice to have both on board in terms of a medication and a behavioral therapy. So a lot of times we'll work in conjunction with psychiatry or a medical doctor to really come at it from a multi-pronged approach with the treatment avenue.
The other thing that you mentioned a couple of times that I would like to just pick up on is the role of the family and how important the family is in both addiction and in this. Can you elaborate a little bit more on how you would involve the family?
I know that in the past with patients I've worked with, oftentimes it was not the patient themselves that was presenting to therapy, but rather the patient's family member who reached out and sought information about services. And so as much as you can, using that as a motivation for treatment can be helpful. So it's gone as far as this individual being involved in the discarding process, helping assist with the sort of clean out that has to happen in the home, but also just using that as a foot in the door with the patient. If you've mentioned that you really want to have your grandchildren over, that you'd like to host Thanksgiving dinner at your home again, when using that sort of family dynamic as a way to leverage treatment and really keep them motivated throughout the process. Exposure-based treatments are hard. It can be difficult to face things that are distressing or that upsetting. And so we see with any exposure-based treatment, whether it be for hoarding or PTSD, that you have a lot of dropout in the initial phases of treatment. And so you really want to try to keep the patient motivated and move them through that process so that they can start to see some of the benefit of the treatment, because that's really when you're going to continue seeing those treatment gains. And so it can be hard. And so I think leveraging anything can be helpful.
So they remove the substance and now they have to tolerate the fact that there's not that much in the house anymore, or they don't want to start accumulating again.
Exactly. And we've even seen a lot with hoarding treatment where other treatments like behavioral activation, which is a really big treatment for depression, because the individual has started to isolate so much. Hoarding can be a really isolating disorder, obviously. And so we've even seen that augmenting traditional CBT for hoarding with behavioral activation, which is really another CBT-based treatment, but really focused in on that B or the behaviors aspect, can be helpful. So getting them to maybe engage in other domains of their life and living the values-based life in those areas can be helpful, whether or not that's with family, relationships, hobbies, recreation, and those sorts of things.
Medications for addiction, like Contrave, like the craving blockers, or even the GLP-1s, where they mitigate some of the addiction drive. Could you see those as being potentially useful?
That's a fascinating question, and I don't know why I've never considered that, but I wonder. I think about, like I mentioned, I work in a substance abuse treatment facility, Long Branch, 1 day a week, and I really think about how we prescribe a lot of naltrexone and Suboxone and other medications for patients. And I think naltrexone is now being used for addiction in general, more off-label. I've seen it being used with things like with food addiction and other things, and so I've never considered whether or not it could work for hoarding, but that's a fascinating question, and one that I think maybe empirically we need to start to look at. If some of these same reward pathways and areas of the brain are implicated in many of these conditions, then could this substance or drug be helpful as an augment to some of the other things that would have to obviously occur in hoarding, just like with addiction, where you have to actually remove some of this stuff from the environment? Yeah,
that's interesting. Because are we talking about, like I said earlier, a spectrum where this is on the one bookend, which is the accumulating and the feeling safe about that. And then the other end, which is just the eating. But we don't have to actually eat it. We can just have it there.
Yes.
With the intention of one day. It's a promissory note. It's a promissory note.
That's a fascinating concept that I've actually not considered, but I think it's really ripe for a new line of research.
I find this fascinating, especially that link between your finding about obesity and eating disorder, whatever we want to call that, binge eating addiction and hoarding. And you're saying it's the emotional piece behind it, the dysregulation or lack of regulation.
I guess the only other thing I would end with is this has got me thinking about another paper that I wrote that you didn't necessarily write me about, but it was actually looking at the link between hoarding and addiction. And now that we're tying all of these three things together, I think we're really onto something here with maybe there being some sort of either underlying emotion regulation problem that's contributing to all of these, or like what Dr. Timpano and others have found, that there may be some sort of genetic or biological component as well that is maybe involved in how these things sort of work and the function that these behaviors serve.
Yeah, it's that primitive hunting and gathering almost gone disarray. Like we're hunting and gathering too much.
Exactly. Yeah. And those fears about the future or what that may bring underlies the continued behavior. I know that the fear isn't rational necessarily. We're not saying it couldn't happen, but the likelihood or the need for it is in much larger excess than what's needed.
Great. That's a great place to end, with a big question mark about how we could think about that further. What is actually next for you in terms of your own work?
Yeah, I think in my work right now, I've shifted gears. When I arrived at the VA, hoarding is actually something that we do see among veterans, although I would say not maybe as common as other conditions like PTSD and addiction. And so some of my work has shifted focus to look at those things as well as eating disorders among veterans, just given that military culture can put a lot of restrictions on weight gain, especially early on. But then trauma, like we've talked about, can also end up resulting in a lot of maladaptive behaviors to regulate negative emotions. And so really my work has been an offshoot of some of this early work that I did in hoarding. But nonetheless, I remain fascinated in general by psychopathology and the sort of desire to want to help solve some of these pressing issues in the field. And honestly, to help people who are struggling with these conditions find some sort of relief and reduction in impairment.
Yeah. The interesting thing that you said is that they're not actually in distress until people are telling them that they have to stop.
Yes. And it's fascinating.
Different than addiction, because eventually the person says, I got to stop. But anyway, last question is our signature question. And that is basically, if you could tell a younger version of yourself something about hoarding, food hoarding, what would it be?
I guess probably just to never lose sight of the reason why I do this research and why this is important, because at the end of the day, there's a life attached to these behaviors. And for these individuals, whether or not they're distressed at the moment, there's clearly some impairment that's coming from the symptoms. And just to always remember why I do this and why it's important. Really, the kind of overall goal is to reduce human suffering in one way or the other.
Okay, thank you.
Thanks for joining us this week on Food Junkies, Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life support group, I'm Sweet Enough. You can subscribe to our show in iTunes or Stitchers. That way you'll never miss an episode. While you're at it, if you found value in this show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. Don't forget to pick up your copy of Dr. Tarman's book, Food Junkies, which is available on Amazon. If you have any additional questions, both Molly and Clarissa are food addiction professionals and work one-on-one with clients. You can find their websites and email addresses in the show notes. Be sure to tune in every Friday when our new episodes drop. As Vera loves to say, the power is ours.